Welcome to another exciting episode of the BB podcast. Today, I know most of you will be wondering, say, why I hold the microphone like this. Today, I take bright position to gym. I prefer to gym in this way, because gymming too sometimes it be very stressful. So anyhow you fit to exercise, you just need to exercise yourself. So you know how we do it. Today's episode is definitely going to be exciting as usual. But today, trust me, if it would be more exciting than ever, because we have professionals in our midst. Not be just to can't talk. We have professionals, people that will tell you the in total of the matter we are coming to talk today. You see, as I hold bright microphone, make it be bright self. As I hold bright microphone now, it means say bright there somewhere, chalk somewhere. I'm sitting with the eloquent, the ever gorgeous, the ever smiling, the sexy Esther Danka Reynolds. Esther,
Hi,
how are you?
I'm fantastic, thank you. How
I
are
was
you
expecting
doing?
like you used to do. See,
Yeah,
sometimes don't be
yeah.
acting if bright no day here. You
No,
go there.
what are you trying to insinuate?
No, like
Hello.
hi.
Good.
Now we have professionals in our midst, two professionals, and today's topic is something that has really been like the talk of town. People they always they talk about. Everybody wants to, especially ladies, and they say women plenty past men. I don't really know how true that is though, but a lot of women are venturing into it now, maybe as a form of enhancing themselves or build confidence. We don't know. But we will get to dive into the social effect, medical effect, and we are coming to talk about BBL, which is they call it the Brazilian butt lift, right?
Yes,
Yeah.
yes, yes.
Right, Esther?
Yes.
Have you
Right.
right?
Right. The
Yeah. We are
Brazilian
coming to
butt
talk
lift.
about BBL.
Yes.
You know what BBL is? When ladies try to, either subtract or add something to their ass to make them look very, curvy and figure eight shaped Coca-Cola bottle that level. Sometimes these days, if they pass Coca-Cola bottle, you go see some be like Schnapp bottle, some be
The guy you
like
go get problem.
some be like
The guy you go
beer
get
bottle.
problem.
No, I'm just saying. But I know say doctor they here where it will give us everything we need to know. Without wasting much time, I want to introduce. Say doctor be very very high position. So maybe I never did that. I not reached yet to introduce doctor. So I go introduce our special nurse. She's no other person but Mrs. Sandra Yella. Let's clap,
Of
clap,
course, of course, of
clap,
course.
clap,
I'm
clap,
here.
clap.
I'm here.
Yeah,
Yeah,
madam,
yeah.
you're welcome.
Thank you.
How are you doing?
I'm fine by His grace.
And I would like you to do us the honor to
Okay.
introduce
Okay.
doctor.
Okay. We have a medical doctor here, Dr. Derick Mokum Yella from University of Ghana.
Wow.
They have worked for almost 10 years with experience. So he's here with us too.
Let's
Thank you.
let's clap. We have Dr. Derick. I know go mention the other one. Make I no go.
Mokum Yella.
Mukumbiela. And
Yeah.
he's the head of that's David's
David Medical Center, yes.
David Medical Center,
Yeah.
just around the Ashima main station, close to the
Yeah, the
Ashima main
night
station.
market.
The night market,
Yeah.
yeah. So if you want to any medical issues, the
Yeah.
David Medical Center.
Yeah.
So today we have doctor and nurse in our midst. So we need to dive into, first of all, before we even dive into the topic of discussion today, let's get to know doctor a little. When you said more than 10 years of experience, doctor, like 10 years in the medical field or combined with your studies in the school.
Okay. In the medical field, I started 2017.
Okay.
So this is 29, this 2025. So that's around going to 7 to 8 years practice in the medical field. Actually, I am a private medical practitioner. I'm working with the David Medical Center, which I head and control. So I'm a general practitioner with vast experience. I have experience in obs and gyne, general surgery, vast knowledge in most of the things, but I'm a general practitioner.
All right.
Yeah.
It's a honor to have you in our
It's
midst.
a big honor.
Very, very big honor.
Of course.
Because when you talk about issues like this, you are very. It's a privilege to have people who have in-depth knowledge, especially medically, because we don't really take medical aspects seriously in this part of our world. So if you get somebody who can tell you the in-depth knowledge, you have to be appreciative.
That's a big
So,
deal.
madam, I want to start the conversation with you concerning our topic today. Don't forget, we are talking about BBL. BBL, the Brazilian butt lift. First, let me ask, generally, why do you think that women undergo BBL?
Oh, as for BBL, it's all about beauty. That's what I have to say. Because I've noticed some before, and I've been with someone who have done some before too. That was last year, January. Yeah, I was there with one of my relatives who passed through it, and it was very nice. I even love to do it because it makes you look like different kind of person. Your body will calm, your breast, everything. You get everything intact. Yes, that's what the men nowadays they like. So I wish to go into it. When I get there, I will also reach there.
Wait. I don't.
You don't get
Wait.
it.
I know
Let me
Esther
come
will.
in. Let me come in.
Okay, let doctor say
Okay,
something.
so you see, when it comes to BBL, it's also part of health. When you define health, health is not just about physical ailments. It's not just about mental ailment. It also goes about psychology. So once a woman thinks that the way I look psychologically is not what I want people to see me, it affects your psychology, and it means you are sick at that point. So you going to seek for BBL is not a bad thing. You are going to cure your psychology, because once you are being given the BBL, the boots enlargement, the tummy tuck, and the breast engorgement, it gives you some confidence. You stand out tall in society. So health-wise, you are more healthier after a BBL than before. So it's also part of health when you look at the definition of health.
Wow. I think this one opened my mind more because
Yeah.
most times when you talk about health, we usually forget the psychological aspect of it, and you really make me understand. But Esther, would you want to undergo a BBL?
Personally, you see, as he was talking, he said psychologically. Personally, I don't see myself sick, or I don't see myself as I need any form of, because I feel I'm perfect the way I am. So I wouldn't do, not because I feel it's not good or anything like that. Personally, I don't think I need that for myself. So I wouldn't do it, but I don't have any problem with anybody else doing it.
So, how about the conversation where they say it's based on insecurity? That's why women go for things like this, just because they don't feel safe about themselves. Fine, I understand it affects your psychology, but then how about accepting your body? Does that mean that God didn't create us well enough that we want to add these things to ourselves?
Not that God didn't create you well. When it comes to BBL, if you do, like doctor said it, you get confidence in yourself. So sometimes, let's assume you have delivered 2, 3, your stomach become big, you don't even look nice, you are out of fashion, you understand what I'm saying? So that one, you would think that you want to do it because you want to get the body to look good, so that anytime your husband will be seeing you happy. As for me, I will go for BBL. Yeah.
Can I, concerning what you said, can I ask a question?
You can ask me a question.
You said when one has 2 or 3 kids, she
Of
gets
course.
her
You
body
get
changes in
yeah.
certain ways. Does it have like an age limit to it?
Concerning doing the
BBL.
BBL.
Concerning doing the BBL?
No.
No, BBL has no age limit.
It doesn't have any age. age limit. No.
So anybody can do
Anybody.
BBL at any time?
Yes.
Yes.
And it
Everything comes from
reacts
your
with
pocket.
everybody's
Your pockets have to
body
talk.
parts the same way.
Yeah. Your
I
your
think,
pockets have to
okay,
talk
when
for
it
you.
talks to reacting, like, talk about the healing process, generally, the more elderly you get, your healing process becomes defective. Like, it's not as fast as a younger person. But that notwithstanding, there are vitamins and medications that could help in healing process, like vitamin C and other things. So when it comes to BBL, if even I've seen women of 70 years doing breast lift. Women of yes. Haven't
Yeah.
you watched movies? You see a woman 70,
breast
the
is
breast is
standing.
still like somehow nice. No, that's not a normal breast for a 70-year-old woman. It's BBL.
So estimatably, what's the length or limits to the healing process?
Okay. Healing, it depends on a lot of factors. So when you do BBL, it depends on a lot of factors how you will heal faster.
Okay.
So for instance, let's say depends on the length of the surgery. Depends if you get infected or not. If there were no infections and antibiotics, you were well treated with antibiotics. Within maximum of 10 days or to 14 days, all the wounds through BBL should have healed. Some even 5 to 7 days.
Okay.
It has healed superficially, then you see nothing.
Yeah.
Yeah, just some few pains, which some pain medication might take.
Pains medication will
So
take
it
care
so
of
it
that.
so it doesn't. And normally those that go through BBL, they don't stay in the hospital after the surgery for so long, maybe a week or two, but after then you'll be discharged.
Okay. Before we come to the medical aspect, I want to ask about, there's this societal perception about BBL. Yeah, fine. Girls, they are cool with it. A lot of girls are, but, and we all know that these things came from the Western world. And before it came, we as Africans were already okay with what we have.
Yeah.
A typical Ghanaian lady is well shaped, gets ass, So where did this thought now come from? Don't you think is a negative impact on the society? Let's forget about the health a bit. Doctor.
I think it depends on the media. So now media shapes how we think, how we look at everything.
True.
So when the whites discovered that the black women had a curvy shape, which was so nice, which is very appetizing to the eyes of everyone, they started doing BBL. And once they started doing BBL, they started selling it on media. So the media space became full with curvy women, curvy buttocks, guitar shape, the Coca-Cola shape. So once the media became full of it, it's like everything you feed your mind with, that is what you want to do.
True.
So when you browse through TikTok, what you see is curvy ladies and all those. So now that brought in the desire, even for the African women that don't have that shape, to want to get it.
Yeah.
So it is how the media have sold BBL, how they have packaged BBL, has now made the craze over it.
But is it not leading us anywhere negative, like doom or something? No. I mean, look at our society now.
Yes.
Nobody wants to take. Right now, you see girl now. The first thing you see when you see a curvy girl, you start thinking is BBL.
Yeah.
Because now it's like nothing is natural anymore. People even, I don't know, before we don't used to think about things like this. You easily see a curvy girl and you'll be okay. But now every curvy girl you see, you'll be screwing through the internet and you see a curvy girl. The first thought that comes into your mind that you have gone to do a BBL, you have gone to do a BBL. So there's now this negative, there's this a stigma that now attached to the BBL that I think is causing a negative impact on the surgery itself?
Because let me add up to what he said. Because now even those who naturally have butts still want more.
More.
Yeah.
So now I don't know. I feel they are becoming too obsessed. And normally when you are too obsessed with somebody or something, it goes haywire.
So yes, like the psychological part of it, like okay, so those that have still want more, that's true, that's the truth. I think it also depends on, before you say something is going haywire, one, when it comes to mental health, you want to see if something is going haywire, is it affecting the person not to be able to carry his daily activities? Such that because of the thoughts of me not having BBL, I can't go out. I can't go to people, to places. I don't want people to see me. Is it affecting you not to carry out your daily activities? You don't want to go to your job site because you are afraid of that you don't have BBL. Then that's when we see that it's impacting your psychology. All of us think about certain things, but the main thing when it comes to mental health, does it affect your day-to-day activities? If it doesn't affect the person's day-to-day activities, yeah, somehow psychologically he's not feeling okay, and maybe he gets a BBL, he's okay, and maybe he gets another one, it's okay, just like a tattoo, you get one, you want to get a second one. Maybe it's okay, but if he or she is able to carry out the daily activities, then psychologically it's not really affecting the person, unless it's
So in the
excluding
case
itself.
of a BBL, what could go wrong?
Oh, like medically,
Yes.
a lot could go wrong. The first one about it is infections. So if you do a BBL in a facility that is not a hospital that is not well maintained,
Well
the theater
trained.
is not well maintained, the instruments are not like decontaminated very well, you could get an infection,
Yeah.
which like you have what they call methicillin stain resistant infection, the MRSA, which are very difficult to treat. It could be very difficult to treat the infection, and then from there you could get septicemia setting, then it could lead to death.
Arthritis.
So we also have what we call emboli, because note that they are going to remove the fat which lies between your skin and your muscle. That area is called the subcutaneous tissue. In the process of using the suction machine to remove that fat, some of the fat can cause what we call an emboli, like, I don't know how I can put it in English, like a bolus, like a small bowl, and it enters into a blood vessel. Now from there, through the blood vessel, it can move to your deep veins, from your deep vein to your lungs, and cause what we call pulmonary embolism, or it could move to your deep veins in your calves and make one of your legs, either the right or whatsoever, become swollen. Then you have what we call that one is now called a deep vein thrombosis, which can now dislodge, then go to your lung and cause a pulmonary embolism. When it goes to your lung, it causes what they call pulmonary embolism. When pulmonary embolism sets in, you can't breathe because you need oxygen from your lungs to breathe, and it is blocking the blood vessels supplying your lungs. So you can't breathe, which may lead to death if not treated immediately. So some are the complications that do occur. Then you have what we call bleeding. We call it in medicine hemorrhage. So it could go during the process. You burst one of the major blood vessels, and the bleeding becomes
to start.
uncontrollable. So hemorrhage, if not well controlled, can also lead to death, just like you having an accident and bleeding. So these are some of the major complications that do occur. It could also, other complications could, so those are complications that occur during the surgery.
During the surgery, yeah.
So after the surgery, you could get a scar which you don't like. So if the scar is not well placed at places that can be protected, it's also a complication. So the scar might make you not to feel happy to put on your bikini to beach and all this stuff. Then
Pains.
Yes, pain is also there.
Pains too is part.
Yes,
You
pain
can
is
be in pain.
painful, but ideally with the anesthesia we have now, you won't feel that much pain because the pain will be controlled. Then the scar could also not heal properly. So you see some people having scar that are not healed properly, it becomes bigger. So you have what we call hypertrophic scar. When it becomes bigger than above the margin of where the scar ends, you have what we call keloids. You've seen
Yes,
some, and
keloids.
it's common in blacks.
Yeah.
So somebody has a cut, then it becomes bigger above where the cuts, So you could get keloids from it. So those are some of the complications.
But with all these complications, ladies still want to go through it.
No, of course.
Because of the outcome.
It's the outcome.
So,
So-
let's say, sorry, I'm cutting. Let's say 10 people go into the hospital for a BBL. What is the margin? Like, how many would
Percentage.
yes
of
would suffer?
the successful
would survive?
ones.
Yes.
Okay, for that, I don't have that statistics. I don't want to
Okay.
give the statistics. I don't know.
That one.
Okay.
Maybe next time I'll go and research.
Okay, but what I want to ask is, does it have a duration? I mean, BBL. After you've done it. Does it last you forever, or you go still they need to go for some treatment and some touches after a period of
It's
time?
just review you have to be going.
It depends on, so what made you to go to BBL before? Maybe your eating habits, you lose shape because of your eating habits, or you lose shape because you're not exercising as before, or you lose shape because of, and let's say eating and exercise, those are the main two. So after the BBL, they've taken out the fat, let's say from your tummy, and they've placed it at your
Your butt.
at your butt. So that's what they call auto transplant. So they've placed it there. If you don't follow the dietitian's advice, you don't exercise regularly, the fat will still build up after a long while in the places you don't want. So you have to follow the dietitian advice and exercise advice to maintain it. So if you don't, you just go back and eat anyhow, it will still build up in the places that it was before. So that's how.
So
it
in the
is.
case of a transplant, can the fat die?
Oh, that's so what I said transplant. It's actually a transplant. They remove a fat from your
Tummy.
Your tummy and
to
put
your
it
boots.
back.
That's a transplant. But this is what we call auto transplant.
Okay.
So it's an autologous transplant. It's from your own body to another part of your body. So do you understand? So whether the fat melts or what, that's what you're trying to say. I don't think so. Because once the transplant is what we call, we say tick. Once the transplant tick means blood vessels, what we call recanalization, are being formed to feed the transplant with nutrients and everything. It shouldn't.
Sorry.
Okay.
Please, so this, you said it's transplant of fats from one side to the other. So in case of a skinny girl, like the girl is like this with
Yes.
no fat at all.
So you
Go for silicone.
And then she wants to.
Silicone.
Yes.
She
They
wants
have,
to.
they have. If you are doing the BBL, they have other things too there. One, you can go for silicone. They have silicone there, so they can use the silicone to just form you as the way you want to be. And first of all, if you are going for BBL, not that you just go straight to the point and they do the BBL for you. You have to take a picture. The doctor have to come and assess you. He will put you on assessment, and he will do different type of picture. You have to choose how you want to be.
Okay.
So how you want to be is how the amount will go.
Oh.
So that's how the BBL is.
So let's say I'm ye small,
Okay.
and I want ye form of figure. Is it more? You said it's silicone.
A
right?
silicone,
Yes.
yeah.
So they use silicone.
Okay.
So it's for the boots, for those that are slimmer.
Slim, yeah.
Yeah, you can use silicone. The silicone is inert. Inert meaning that it doesn't react with the human body.
Okay.
And it has almost, the side effects are almost negligible. Like there are almost no side effects, but we can't say they are almost.
The
There
side
are some
effects
side
is
effects, but it's
beauty.
almost negligible, almost not negligible.
For the silicone.
Yes, for the
Yes.
silicone. So it's in it. Like it doesn't react with your human body. So they place it where you want, and then they cover it with a skin flap. So
Yeah.
your skin is used to cover
cover it.
and then shape it.
Wait. So the silicone is not part of our body, crap.
No.
Just like you put rubber inside somebody's body, then
Yes.
use.
Yes. You can also use it for the breast.
It can also be used for the breast.
But
Okay.
can't that cause cancer or something?
No.
No,
Since
that's why I
it's-
said the silicone
No, it
from
don't
studies,
react.
it is in it. So it doesn't
React
react to the
on your
human
body.
body. It has no reactions to the human body.
You can even deliver once you have done the breast. You can deliver breastfeed. It will not done anything to your children.
Oh, I see.
Yeah.
So there's this normal perception. I don't know how true it is because I never really go close to somebody where do BBL before. But they say it smells.
No.
That there's even a time on social media where they say Cardi B,
Yes.
No.
her
had,
boyfriend came out and said her BBL smells
smells
and
No.
all of that. So let's educate our audience. Does it smell maybe after some time or during, before or after?
I don't think it will smell. at
No.
all.
No. Don't smell.
It doesn't.
It's your
It
skin.
won't smell because, like I said, once there is a tick of the transplant, the other part accepts the transplant. Why will it smell? It becomes part of your body. It's just
It don't
like, for
smell.
instance, somebody has a burn. You've seen those that have burn.
Yeah.
Then there's a skin that is not healing. They take part of the skin from the thigh to come and put it there. Does it smell? It doesn't smell.
But when
So
you
why
were
should it be
when you
worse?
were talking, you spoke about bacterial infections.
Yeah, so if it only if it smells, that is like, let's say you just had a BBL and you have a wound.
And the wound is not healing.
Because once after the BBL, they will leave some drains for fluid to drain out. Then there will be some wounds that will take time to heal. Like I
Yeah.
said, it will take about 7 to 14 days
Yeah.
for everything to heal. So if it becomes infected, it's just like you having a cut or you had a cesarean section and your cesarean section
You
becomes
didn't take good
infected.
care of it.
Obviously, it will
Get
it will have
infected.
some scent, but once it's well treated and the process is all over,
Nothing
no,
will come out.
it's not-
Nothing.
there's no smell.
Nothing.
Bright, when you watch this episode, hear for your ears, say it
Say, no,
doesn't
they
smell.
smell.
Because there's a lot
Oh,
of
it don't
perception.
smell. It don't smell.
Yeah, there's a lot of perception.
I have a relative, as I said. He have done it almost 2 years now. No complication.
It doesn't
Nothing,
smell.
nothing. Even it takes even 2 months to do all the procedure. He did the bottles. After then he came to the tummy and the breast. She is looking good and excellent.
And let me add one more thing. BBL is not only for women.
Okay.
Even men.
This
Even
one I
men
go laugh,
also go
oh.
for it. Of course.
Please.
BBL is not only for women.
Okay.
Some men do go for tummy tuck.
Those their
Okay.
stomach is very big.
Yeah.
They go for it.
Some men do go for
It's
tummy
just that
tuck.
your
It's not
your
only for
eating
women.
appetite will just calm down. You cannot be
So
eating
it's
much
not only for women. So
like
men,
the way you were thinking.
yeah. So men do tummy tuck, like men with big tummy. Then you want to look. Have you not seen a man that is huge but the tummy is flat?
Yeah.
Some of them they have gone for BBL.
Tummy tucks.
So yeah, go for tummy. You are huge but your tummy is flat. So you do the tummy tuck, then they reduce the tummy and make it flat and makes your shape looks nicer.
So in the case of a transgender that we now see on social media that transgenders go for BBL.
Oh,
to
this one you
get-
brought transgender
To
there.
go for-
We are in Ghana. Oh.
No,
let's
no,
not talk
no.
about transgender.
Eh?
It's against our constitution.
We don't even do. Have you
No,
seen a
we don't-
transgender
we
before?
don't. We can't talk
Bobrisky.
about that. No.
Bobrisky no be. We don't- so, Doc, please, before I come to you, Doc, Madam,
Yes, please.
with a honest heart, would you advise any woman to do BBL?
This one, unless I think of it very well. I wish for every woman to do that so that you not just look old. If you do BBL, your beauty come, you change. If you are the age of 60 and your body is looking old, it changes you a whole lot of things. So BBL, as for me, I would love to do BBL, but I don't know how I would say. Other people, it depends the money too. It's not everyone that can afford it.
Is
Is
it very
that expensive?
It's expensive. It's expensive. Only the breast itself go for a cost before the tummy, before your because it's very expensive.
And do we really have like real professionals in Ghana?
Yes, they have
does?
it. I knew one hospital. That's where my relative, he did his own.
Don't worry, don't worry.
I'll remember
Don't worry,
the
don't give
name.
them free
Don't
adverts.
call them.
Plenty people also go there and do it. And we have even one Catholic hospital that also does it here
Wow.
in Kumasi.
So, Doc, at what point would you stop somebody don't do BBL?
Okay, like I said, it depends on a lot of factors. So
Even when the girl don't feel, maybe the girl is sick psychologically because she's not feeling okay with the way she looks and all of that. At what point would you say, oh, please leave your body like this?
okay, that's what I'm saying, that it depends on a lot of things.
Okay.
So before somebody goes and do BBL, there's a lot of tests, what you call workup, that you have to do before the person will be eligible. So I won't take somebody that has, those that have bleeding tendencies. There are people that have bleeding tendencies. So when you do their bleeding time and you see that this person, if you're going to do a BBL, you won't be able to control the bleeding. No surgeon will take you to do a BBL. So then there are those that their platelet levels are very low. So the surgeon will realize that if your platelet levels are very low, then he knows that there'll be a clotting difficulty, so he won't allow you to do a BBL. Then before they do the BBL, they also do what they call the kidney function test and the liver function test. If your kidneys are not functioning very well, no surgeon will want to do a BBL because the kidneys will play a very big part in the medications you will take during the BBL to eliminate them. So if they are not functioning very well, doing a BBL for somebody that the kidneys are not functioning very well, it will be a difficulty in the healing process about it. And the livers also, they do a lot of tests, they call liver function tests also. So they'll check the liver function tests. If they are not okay, then they want to correct that before the BBL. Then also, there are some clients, but some surgeons might do. So it depends on which medication the surgeon wants to use. So they also do what they call G6PD. So if the person G6PD is full defect, and the doctor is anticipating of using maybe a sulfur-containing medication during the BBL, he might want to maybe use an alternative medication or not to use, because those with G6PD do react to sulfur-containing medications. So they look at all these factors and then.
What about if the person is diabetic?
Yes, also diabetic too. Yes, I forgot about that. It's also it plays a very big part. If the person is diabetic, diabetic clients have a very difficulty for their wounds to heal.
Yes.
Yeah, so if the person is diabetic, the surgeon will not want to do, or me wants a physician to control the diabetes well controlled than before attempting to do it. Then also the blood pressure, if the person BPs are very high, they want it to be well controlled before, because it's a long procedure that can take sometimes about 7 to 8 hours in the theater. So if your BPs are not well controlled, a lot of things can happen during the process of it. So those things, if all those things are not well properly arranged, no doctor wants to do that for you.
Wow. So my last question, I think we're almost ending, right? So what do you also think about people who say that women do BBL just to look nice for men? Madam.
True, I went to doctor. I've already talked what I want to talk.
Okay, but
You that went
actually,
to doctor.
who are they looking nice for?
It's not the men.
Oh,
So
no,
the
no,
men
no,
have
no,
to
no, no,
look
no,
at
no,
it.
no.
It's the men.
So
It's the
that,
men.
like I said, it builds you self-confidence. A
It's
human
the
being
men.
like we are not living in isolation. We live with people. And as every human being, you want somebody to appreciate you. If you buy a new shirt, you want somebody to tell you, oh, you're looking nice, your shirt looks nice. If a woman does new hair, he wants a husband to tell, oh, this your hair
You
looks
see, I
good
tell
on
it's for
you.
the men.
So
You understand it?
you want to be appreciated. And it's not just only for the men. some women will walk up to another woman and tell you, "Oh, you're looking very good." She feels very happy. So it's not just for men, but all what she wants to do, she wants to be noticed. She wants to be appreciated where she does that. She's looking nice by both men and women.
So right now, in other words, you mean we are crucifying women for just wanting to look nice? Because it's almost like crucifixion.
Yeah.
The moment you do BBL, there's a
Then they
stigma
categorize
attached to
you
you.
in
So that
certain
means
ways.
we shouldn't see it as anything negative.
Oh
At
no.
all.
Oh no, you shouldn't see as anything negative. People
I
do
wish
it
say
just
bright
to look-
day, yeah, Sha.
People do it just to look nice. So maybe unless the person has any other motive behind, maybe some people have other motives behind. But the main thing about it is they want to look nice. They want to look nice in their dresses. So you see a woman who says, "Oh, when I always put on this type of dress, it doesn't look nice on me." But
Why is it that we are buying bottles in the market?
yes, but
at
when I
first?
after the
People be
BBL,
buying
now
it.
my dresses now looks nice.
Everyone,
everybody wants to look
nowadays,
nice.
even the weddings nowadays going on, plenty people wear the
Buttocks.
bottles. They
Hip
wear it so that
pads.
the kente and the dress he's wearing, he will look good. So the BBL is the beauty. Yeah.
All right. So BBL, according to doctor and nurse, there's nothing wrong with it. I mean,
Yeah.
it's just a societal stigma that is attached to it. So before I'll finally conclude, I just want doctor to just give his final words concerning this topic and probably tell us a little about David's Medical Center.
Okay, so concerning this topic, if you think you need a BBL, go see your doctor. If you're closer to a Ashaiman, for now, my facility, we've not started doing BBL, but we have plans of starting within the next 1 year. But we do have team of doctors that do BBL, which we can link you up to them. Either they will do it at the facility or you go to their facility. So we have that arrangement. So if you want to do BBL, feel free, walk into the David Medical Center, former HFC Bank building just behind the government school, and we will help you with that. If you need to call my personal line, you can get me on 055-612-6328. Then we also do other surgeries regularly. Myomectomy, that's fibroid. We do lipoma, that is excision of skin tags and all those things you see swell on people's skin. Yeah. We do hernia repairs, so if you have hernia, you want to repair it, you could also come. We also do, we have a team of surgeons that come and do goiter surgery.
Wow.
Yeah, then we do umbilical hernia also surgery. Then which have
Wow,
I?
a lot is going on at
Yes, we do
David's Medical Center.
cystectomy. So there are some women that have cysts. Yeah, then we also do infertility cases. So if you're trying to get pregnant and you don't know where to go, just walk into the David Medical Center, Ashaiman, Nice Market.
Wow.
Thank you.
Madam, maybe you have a final word to say to the ladies.
Oh.
Ladies,
The only thing I will just talk is for them to go and do BBL. I'm still waiting to look good more than them. So it's just competition. So they have to look for the BBL and do it. Thank you.
Esther.
I think I've learned a lot. I've learned a lot from Doc. We learned about the smell, which is not,
It's just a person,
Yes.
just people's.
Perception.
and we've learned a lot about those who also cannot undergo it because of medical conditions. So it has been an exciting episode as always. I think,
For me, most especially, I think Bright has also learned a lot.
yes, he has. He
because
has.
Even
manager has learned
We
a
actually
lot.
need,
Manager
we
is
actually
very
needed him
quiet.
here.
Manager have taken a lot of things from us because he's very quiet. Today, I know this night you are going for your wife to go and do it tomorrow morning. 6 o'clock dawn.
Yes. He's the
That's
one we
true,
are
that's
talking
true.
about. Oh. He's the one we are talking about. He has
Okay,
learned
I can
a lot.
even see.
Yes.
I can even
So
see it from his face.
his
He has been smiling now,
mindset.
thinking of how I'll pay the money, how is my wife going to be, how I'm going to sex him after then. Don't worry, we are there for you, manager. Don't worry, we are there for you.
All right. So I mean, this is one of the most insightful conversation we've had, and according to doctor, medically is acceptable. You just have to look at yourself. If you feel good about yourself, fine. If you don't feel good about yourself, and if you want to touch one or two things, and you are medically fit, don't forget, say you need to also go for checkup to see, say yes, you are liable for such surgery, so that you know you go die young or get some complications just because you want to look good like everybody. And then one thing I've also learned is that people do it just to look good for themselves, not just to look good for people. So make sure you are looking good for yourself. When you look at the mirror, you see say maybe you see say the shape, not
Self-confidence.
Self-confidence, yeah. And these days too, that's what sells. Doctor even say, even in the media, that they throw girls with big butts to our faces. If you want to even go newscaster self, you have to have big butts. If you have to be an actress, you have to have big butts. So I mean, it's becoming the norm of the society.
true.
So we can't change it. We just need to embrace it.
The
as
most
it is.
important thing is you go to a qualified.
Yes, go to a qualified, and then please, you can just walk into David's medical center and get it done. Yeah. Thank you very much for sticking and staying with us to the end of the episode. Don't forget that if no before Bliss Venue, probably we'll not go fit there. Just walk into Bliss Venue. It's at Committee 6. They have a sky bar, they have a sky pool. If you want to swim, if you just look up, you go fit just they see angels, they walk around. It's closer to heaven. If you want to also take a shot close to heaven too, there's a sky bar there, Bliss Venue. Very serene environment where you can get cozy. Your first date or last date self, you can have it here at Bliss Venue.
Even if you want to end your marriage, please.
I know we may talk that one though.
Bliss Venue is the location.
Location
Thank you
be.
very much.
If you want to have any kind of event, wedding, reception, birthday party, even want to host friends self, you want to pop bottles. Yeah, the Sky Bar is there. Bliss Venue is a place. And don't forget to subscribe to our YouTube channel. Leave a comment. Just let us know, say you there alive. Let us know, say you they feel what you would talk. And let us know what you also think about this particular topic. And God go bless you.
And please do well to watch the full episode.
Yeah, sometimes
Do
people
well.
just watch
They
the
just watch
snippets and then they
halfway and
judge.
then, yes.
Watch the episode so that you go learn
a lot.
a lot. Thank you very much. My name is Steven Akpesiri, and then I did this with my eloquent Esther Dacarenos. Thank you, doctor. Thank you very much, madam, for coming. I know I give you pressure a lot, but
I know.
thank you
Okay.
very much.
Shall be well.
Bye bye. We are out.
Okay, thank you. Bye.